For our resource presentation, my group decided to do autism spectrum disorder. Um, my name is Maritza Ruvalcaba. The other members of my group are Kristal, Elizabeth, and Anthony. So here on our homepage, what we'll see first is what is autism spectrum disorder. We have the definition here from our textbook. It says autism spectrum disorder is a developmental disorder that presents challenges in a person's verbal and nonverbal communication and their social interactions or social skills. Individuals with autism also display restrictive and repetitive behaviors. We have here a statistic from the CDC that estimates 1 in 54 children have been identified with autism spectrum disorder. If we scroll a little bit more down, we'll find a definition from the Individuals with Disabilities Education Act, another from Autism Speaks. Then we'll see links for the signs of autism. The CDC here provides signs and symptoms for autism spectrum disorder. And then we can scroll a little down and we see that 1 in 54 children who live in autism and developmental disabilities monitoring networks have been identified with autism spectrum disorder. Then if we scroll a little down, we'll see what is autism spectrum disorder. This is a link from the CDC where parents can find more information about the signs and symptoms, the diagnosis, treatment, causes and risk factors, and any other concerns that they might have, like economic costs. Then if we scroll down here, we see understanding the spectrum. Rebecca Burgess has created a comic about autism spectrum disorder and how it looks differently between people with autism. So one important thing to remember is that autism is not the same for all. It can be different for each person who has it. And this is a video narration of the comic. Then we go down to causes. We can find 2 videos here. The one on the left is a little bit of the history of how autism has been described through the years. And here on the right, we have autism spectrum disorder. It's a video with animations about causes and symptoms and diagnosis. Then we scroll down to misconceptions and misinformation. It has come into question a concern about a link between vaccines and autism. The CDC here provides some resources to studies that have shown that there is no link between the two. And here we can find another article from Autism Speaks that also confirms that there is no association between the two. And then next, Anthony will be talking about social interaction.
Hi. Our next topic that we're going to go over is social interaction. Children are more likely to gain social skills from their interactions with one another than adults. A few things that we want to keep in mind if we scroll down. A few things we want to keep in mind when dealing with children with autism is that children learn through play. Play is really important. A few things that children with autism learn through play is they learn how to interact with their peers. They learn how to respond in appropriate ways. And they learn how to explore and they learn about their environment. And they learn how to share their objects and attention with others. The next thing that we want to talk about is communication. When communicating with a child with autism, we want to make sure that we are trying to communicate with them at the right time. Children with autism are used to routines, and if we try to talk to them when they're in the middle of something, we're not going to get the best response from them because they're already doing something. Also, expressing our thoughts verbally might not always be the best way. When we communicate with them, if verbally isn't always the best, some other things that we want to maybe try, we could try writing down, singing, drawing. We might not always understand, they might not always understand our words, but can understand in different ways. Lastly, patience. Patience is really important when dealing with a child with autism. Children with autism need a little bit more time to process things, and we need to make sure that we are flexible. At the end of the day, they are still a child that's growing and developing, and who are not defined by their autism. They just learn in different ways. Below are 2 videos that go into further detail about building social skills and teaching social skills to children with autism.
Hello, so I'll be talking about communication. So children with autism can have different ranges of communication depending on the child. Some depends on their intellectual and social development. So some children are able to communicate using speech and language, while others have limited speaking skills. And then other children who are high functioning are actually going to be able to talk about very specific subjects in great detail and might need just more support with the pragmatics and conversation. So what we want to make sure is that we take that into consideration and think of each child. And we also have to think about nonverbal communication and body language as part of our communication as well, and some things that students with autism might struggle with, and they might struggle with just focusing on one topic and talking about just one topic that they feel interested in. And down here, we have actually some support for students that have autism. So one thing that's really going to support all students, but especially those with autism, are using gestures and visuals. So pairing our auditory information, what we say out loud, with some pictures to support. And that goes along with any even printed material as well, because that picture is a visual reminder for them and something that they tend to be able to understand really well. Another strategy that we can use to support students with autism in their communication is using role play. So role playing means that we have conversational interactions that we're practicing and mimicking what it looks like to have a conversation with a peer or with another person. And down here we have an article that talks about the importance of role play and that it is an effective strategy, and the way we can give scripts to students to be able to help them have that conversation with a peer. For example, if they want to play with a peer, they might need to ask, and then we also give them opportunities for outcomes. So what happens if the peer says no, or if the situation doesn't go as they planned, what they can do. And one of the last strategies that we have to support students with autism in their communication is using augmentative and alternative communication, so AAC supports. And some examples of that are going to be PEGs, are going to be sign language communication boards. And a lot of times when we think of AAC, we might think of something that's high tech, but it can also be something that's low tech. So down here we have an article that gives parents more information on what is AAC and the ways they can make it more low tech or more functional for their families. And that's it for the communication piece.
Hi, so I'm going to be talking about repetitive and restricted behaviors. As mentioned here, it says restrictive and repetitive behaviors are specifically categorized in the autism spectrum. They include repetitive movements with objects, repeated body movements, obsessive interest, and sensory vulnerability. As you can see in the first picture here, it talks about the objects that they can use to help soothe their anxiety or their nervousness. And some of the objects that they use are fidget spinners, clicking boxes, clicking pens, toys that stretch or pull or that they can nibble on. The next picture talks about repetitive body movements. So a child with autism will flap their hands or rock back and forth to minimize or maximize the amount of stimuli in their environment. And again, it is like an attempt to gain sensory input. So they use rocking or flapping, sometimes even flapping for visual stimulation, and also to stimulate and balance themselves so that they can be able to handle whatever is presented to them. If they're learning something in particular, or if they're going to try something new, it helps them to balance out what they're feeling so that they can be able to do the things that they're learning or about to do for the first time. The next one talks about circumscribed interest. A child with autism will focus mainly on specific and narrow subjects that appeal their interest. So some examples are Legos, cars, drawing, sketching, sometimes even painting or building blocks. They're very interested in numbers and math and math problems, or putting things together or breaking them apart. And this helps them with coping with everyday life. So the things that they use to build, it'll also help them stimulate and calm them down, calm their anxiety or soothe them when they're nervous. The last one that it talks about sensory sensitivities. So a child with autism can become overly stimulated through their 5 senses. So it can trigger their hearing if it's something that's overwhelming them because it's a loud noise. If it's something they're seeing, maybe like a large crowd, or a scent, something they smell that doesn't sit well with them. It can also be taste. Students with autism tend to only like certain things to eat. And also what they feel. So some students with autism they don't like to wear, let's say material like jeans. They'll wear something softer that's more comfortable for them and makes them feel safe. Something hard like a jean will be it would be like a sensory overload for them when they walk, when they sit. Maybe it's just the uncomfort. It is not something that they like to feel upon their skin. If you look at the bottom where it says flexible seating, they talk about how it supports their sensory. There's different things that we can also give students with autism to help them. Not just flexible seating, but also different types of comfort for them. So they can use yoga balls, they can have different types of stools. This can provide different choices for the students so that they can be able to focus when they're in class. Sometimes even students need to just kneel or be on their bottoms, and just giving them extra choices on how they're learning and how they're in the classroom so that they feel comfortable enough to want to learn and not focus on what's uncomfortable for them. The last 2 videos that you see, one is for what is autistic flapping. So it's a descriptor. It tells you what it is and why they do it and how you can manage it. The next one is building bridges. So it talks about anxiety treatments for children and adolescents with autism, the spectrum disorder. And then the final one is a link to help students. It shows you how to prime them throughout the day or for specific things that you'll be working on with the student. It pretty much talks about how students with autism need to be told, and they need to be able to see, let's say, a schedule or a routine that you have in place for them. It talks about how important it is to show them beforehand what they're going to be doing, how it looks, and how, you know, you can guide them through it by modeling it, and then also being along with them and practicing with them. So that's pretty much it for, oh, I'm sorry, I have one more part. The last part talks about challenging behaviors, and this is a toolkit. This kit will provide you with strategies and resources to address challenging behaviors that were not all mentioned here, but it will help support you during difficult situations and handling situations with students with autism. And that's it. Thank you.